In this HMIS training video, we will cover how to track a client's history of homelessness to determine if a client is considered chronically homeless or not. This is captured within every program entry. When we're tracking the client's history of homelessness, we're counting the number of times a client has experienced literal homelessness in the past 3 years and how long each of those episodes of homelessness lasted. As a refresher from the definitions of homelessness video, a client is considered literally homeless by HUD if they are staying in a place not meant for human habitation, like outside, in their car, or in an emergency shelter. Or is it exiting an institution where they resided for 90 days or less and who resided in an emergency shelter or place not meant for human habitation immediately before entering that institution? An individual is considered chronically homeless by HUD if they have experienced literal homelessness for the past 12 months with no breaks in their homelessness in that time, or if they have experienced 4 or more episodes of literal homelessness in the past 3 years, and across those 4 separate episodes, it adds up to a year or more of literal homelessness. So what are considered the breaks in a client's history of homelessness when we're tracking this history? A break in a client's homelessness, according to HUD, is any time a client stays inside with someone, like a friend or family member, for 7 consecutive nights, or a hotel paid for by the client, or inside of an apartment for 7 consecutive nights or longer. Or anytime a client has been in any institutional setting, like a jail, hospital, or inpatient treatment center, for 90 days or more. To track the client's history of homelessness, the best way to do this is to backtrack with the client over the past 3 years. Let the client know you'll be tracking their history of homelessness over the past 3 years and start by asking, where did you stay last night, or where did you sleep last night? Let's say they say that they were staying outside. Next, ask, how long did you stay outside for? And then the next question would be, where did you stay before that? And just continuing backtracking until you reach 3 years back. And definitely recommend having a system, either a graph or writing it down step by step on paper, really whatever method works best for you to track the client's history of homelessness. And then this image that you'll see on the right of the slide is how that information is collected in HMIS within the program entry. So those are the questions that are asked within the entry. We use the history of homelessness that we track with the client to answer those questions. Next, we'll be going through 3 examples of how to track the history of homelessness with a client. This is the first example we're going to cover to track a client's history of homelessness, and we're also going to be allowing you to practice on your end for the next 2 examples. I'm going to read through this first example and show how this can be tracked either in words or on a graph with a timeline for each year. So this first example states that the client is currently staying at the Arch, Urban Alchemy, for a month. Before the Arch, they were staying at their friend's place for 2 weeks. Before their friend's place, they were at the McCabe Treatment Center for 1.5 months. Before the McCabe Center, they were on the streets for 3 months. Then a boarding home where they paid rent for 6 months. Prior to the boarding home, they were on the streets for 1 year. Prior to that, they stayed with their aunt in San Antonio for 2 weeks. And then before San Antonio, they were at an emergency shelter for a year. And so we see how this can be tracked in a timeline, if that's a helpful method, or you can write those out like we see on the left of this slide. And typically I like to circle the episodes of literal homelessness there so those stick out and are more obvious. This is the first example, and on the next slide we'll cover if this is considered chronically homeless or not. According to this example, the client would be considered chronically homeless because the client has experienced 4 or more episodes of homelessness in the past 3 years. The screenshot on the right then shows how this information from tracking that history of homelessness is then transferred into the HMIS program entry from that first example. And so the questions within HMIS, the first one will ask for the approximate date that this episode of homelessness started, not when the client's homelessness started in general, but when this current episode started. Then the next question in HMIS will ask, regardless of where they stayed last night, number of times the client has been on the streets, in emergency shelter, or safe haven in the past 3 years, including today. So this is where we capture that this client experienced homelessness 4 or more times in the past 3 years. And then the last question will ask the total number of months the client experienced homelessness. And so this is more than 12 months over those 4 episodes. And then within some program entries, there will be a specific question asking, is this client chronically homeless? That will especially be on the coordinated assessment for clients. And then it's in some other program entries. But if that question is not on your program entry, that is okay. For this second example, I'll read through the client's history of homelessness and then invite you to either draw a graph or use your own tracking method to track this example for this test client. There will then be a quiz question asking if this client is experiencing chronic homelessness or not from this example. And I'm going to read through this scenario. So this scenario says that the client is currently staying at the safe shelter and has been staying there for the past year. Prior to that, they were outside for 3 months. Before, they stayed at a friend's place for 3 months. Before their friend's place, they stayed in their car for 1 month. And lastly, before they were in their car, they were renting an apartment for 4 years. For this example, the client is considered chronically homeless because they experienced homelessness for the past 12 months straight without any breaks in that episode, and they have a disability. And if you look on the image on the right, this is how that information would be answered on those 3 questions within the program entry. Now I'll read through one last example and again invite you to track this on your end by either drawing the outline on the slide or using your own tracking method. So for this example, the client has been staying in their car for 6 months. Before that, they were in jail for 4 months. Prior to getting arrested, they were sleeping close to I-35 under a bridge for 2 months. Prior to that, they were at a friend's house for 1 month. Prior to the friend's house, they were out camping in the woods for 3 months. Before the woods, they were in jail for 2 months. Before jail in 2023, they were out in the woods for 3 years. For this final example, the client does not meet chronic status because this client had a break in their homelessness within the past year, and they experienced 3 episodes of homelessness total over the past 3 years. So they would have needed 1 more episode of homelessness to be considered chronically homeless by HUD. And we see that this is how this would be tracked if you use the graph method, or of course you can write this out or use your own method to track that. And then we see in the image on the right how this would be used to answer the questions within HMIS. So we see that there were 3 episodes, and we see when that first episode started. And that concludes the final example for this video. As always, if you have any questions around the content that was covered in this video, please feel free to reach out through the HMIS help desk and we can answer those for you.